Hello everybody. Okay, we'll start promptly. Again, I'm a little bit late. My Turkish presentation usually takes time, longer than I program, I plan. Okay, so in the program, in our Facebook group, we've been doing the alkaline diet this week. Hopefully everybody's getting good experience again. The last time we did, few weeks ago, it was great. Everybody enjoyed. It was anti-inflammatory diet. Everybody enjoyed, and their waistline went down, and then no inflammation. Everybody felt great. Hopefully you guys are having the same experience this week. Okay, so and next week, Monday, we're starting again calorie counting. Those 2 last weeks will be our calorie counting, calorie restriction weeks. So last time we did 1,500 calories, and not everybody was able to get result from it. But I wanted to do this safe. Start with 1,500 and go back down slowly to 1,300 and 1,200. As you know, for ladies, we're not going down less than 1,200 calories a day. For gentlemen, no less than 1,900 this week, but next week, no less than 1,800 calories a day for gentlemen. Okay, so again, use your applications, phone apps to count the calories, and also meal planning is very important. Okay, we will talk more about that. So I will be writing, I will be posting about that. If you have questions, please ask again. Okay, so today our subject is menopause brain. Okay, so let's talk about this menopause brain. What happens to us when we are in menopause in our brains, ladies? We ladies, we're good until like mid-age, like functioning very well, raising our kids, functioning at our work, everything is fine. But around this middle age, like after like 40s, we start noticing some changes. Some people are noticing these changes very abruptly, very sudden. Some people are over the years. So with my observations, even the people who use their brain a lot, who read a lot, very professional, very like career ladies, even they at some point hit a stage in their lives that in maybe weeks, in like even days, they start feeling like unhappiness, sleep problems, forgetfulness, like irritability and brain fog. And then comes these hot flashes and night sweats. Of course, like this last 1 year of this perimenopause, they start having irregular periods. So they come to doctors, they come to me, they go to their doctors with all these symptoms. Oh, what's going on with me? I'm having all these changes. Even they cannot think because they are still having their periods. Even doctors dismiss those symptoms because they are not even having irregularities yet. Everything is going well. They are having monthly cycles, and we just dismiss them. We just say, yeah, it's just like a period of time, I guess. We just give them, antidepressants or sleep medications. Some people come with frozen shoulder. That's the very common one. Frozen shoulder, joint pains, hand joint pains. And we just give them a pain medication and just bye. So unfortunately, we don't understand women very well. And there are not even many studies about them, especially this period of time, the perimenopause, postmenopause. We just unfortunately, medical system dismisses these ladies' symptoms, and we're just treating their symptoms, not the root cause. Okay, yeah, many women come, we say they're irritable, they say that, oh, I feel like killing my husband, like jokingly, like they are just so irritable at that point. They have the hot flashes, stress, anxiety, depression symptoms. So medical system only pay attention to them when they have hot flashes, because hot flashes are embarrassing for them. They can't even function. They don't even want to leave the house because they just turn purple, like with sweat, drenched in sweat, in the middle of their either conference or their classes, or in the public. So only in those situations sometimes we pay attention to them and give maybe like hormone replacement treatment for a short time. So, but nobody pays attention when they have problems with urinary tract, frequent urinary tract infections. They cannot hold their urine, like leaks, dryness, vaginal dryness. And that vaginal dryness comes to the level that is just like so raw and then inflamed red, and they can't even sit on it. Just like we just dismiss them, especially if they are still having their periods. Yeah, if it's not more than 1 year after they stop having periods, they don't even call them premenopausal. But as you know, even before having irregularities, 7 years before these symptoms are happening, estrogen withdrawal is happening. It's very important. So we're talking about, these symptoms, but there are things that we don't even see yet. A lot of things happening in the brain, a lot of changes as well. So perimenopause, for example, my patients, I wonder if I'm going perimenopause, but there is not enough valid test for this. So there are tests to check for, pregnant ladies, this and that, those hormones, but they are not really valid for premenopausal ladies, because hormone fluctuation happens a lot in that period. Okay, perimenopause is diagnosed clinically with the symptoms, not with lab tests, for example. For example, my estradiol level may be 50. I have no symptoms, and someone else's is 50, but she has all variety of symptoms, from hot flashes and dryness, and then forgetfulness, this and that. So the hormones really, the levels don't really serve our purpose in terms of diagnosing perimenopause or postmenopause. So why we are focusing, or like, okay, let's say this is like stage of life, it's going to go away, people are gonna again start feeling okay, no hot flashes anymore, this and that. But there are 3 major risk factors. That's why these perimenopausal, postmenopausal ladies need to have a lot of attention. What are those risk factors? Very fatal risk factors: heart attacks, osteoporosis, and Alzheimer's. Okay, so that's why this stage is very critical. Okay, let's talk about this menopause and brain connection. Okay, first of all, woman brain and man brain are not the same. They are different. These Alzheimer cases, 2/3 of them are women, 1/3 is man. So we are having twice as much Alzheimer risk than men, especially after this menopausal age. We start seeing, and earlier, we're noticing this in women earlier. Okay, so there is this neuroscientist, Dr. Mosconi. She's very famous in this field. Okay, she had studies, multiple studies. In her studies, she realized that men's brain and women's brain are aging differently. Most of us think that our brain is separate from our body. It's like, there's this blood-brain barrier. It's just like, it's okay. Brain is still okay functioning. No. Okay. Every day, what you're doing, what you're eating affects the brain. Okay. And hormones too. Estrogen, okay, Our dominant hormone is estrogen. Men's is testosterone, right? This estrogen makes the brain grow, makes the brain function better. Okay? When we have the withdrawal, we see the symptoms, right? Hot flashes, night sweats, insomnia, memory loss, anxiety. Okay? So men are not having the hormonal decline, testosterone decline in their 40s, 50s. They are having it way later. So that's why our symptoms happen more like in this like midlife, okay, 40s, 50s. So theirs is much later. So as I said, estrogen problems not only in our ovaries and not in the other parts of the body, it's in the brain, because there are a lot of estrogen receptors in brain. Okay, estrogen is very critical for the brain. So brain is the part of endocrine system. Okay, every day they are in connection. Okay, every day there is estrogen hormone, every receptor in the brain. You know, when we have the withdrawal in the brain, there is inflammation cascade starting in the brain, in the gray matter especially. Okay, all these serotonin, dopamine, norepinephrine transmitters then don't work. So those connections between neuron cells, the connection doesn't work. Mitochondria doesn't work. Remember mitochondria? We talked last week and even the week before with the thyroid. So mitochondria numbers is declining, and also mitochondria function is declining. So we are aging in the brain as well. It's because of estrogen. Okay, so that's why we start having forgetfulness, sleep problems, metabolism changes, energy changes, and even, you know, bodily we start gaining weight. Okay, estradiol is a key in the brain. Okay, estrogen pushes neurons to burn glucose to make energy. It's that critical. Okay, that's why we're having this tiredness or fatigue all the time around the menopausal state. So if the estrogen level rises, energy rises. If the estrogen level declines, energy declines. Okay, so neurons slowly slow down, and then aging starts, neuron aging. Okay, so in like Alzheimer, like amyloid plaques start building, that may lead to dementia, Alzheimer. Okay, estrogen, you know, as you know, mainly starts with hot flashes. So this is the hypothalamus, the center for balance for the term regulation, temperature regulation, right? So that's why heat sensitivities like hot flashes start early on. So it affects the brain stem too. When there is not enough estrogen in the brain stem, sleep gets affected. Okay, sleep problems start. And amygdala and hippocampus, this place, this area in the brain is for senses, you know, like anxiety, forgetfulness. So we start having problems with that sense. We become more sensitive. So bipolar, like diseases like bipolar start, you know, around this age too, if especially we have the tendency. Okay, we forget things. So in Dr. Mosconi's study, she did the images of the brain for 43-year-old ladies, and she did 8 years later and compared them. Okay, according to her findings, energy production in the brain 8 years later, 30% went down. That's a significant difference. Okay. So as I said, mitochondria is aging, not functioning very well. 30% decline 8 years later. So that's around 51, right? Average age in United States for menopause is 51. So that correlates. So a woman brain, basically woman brain is more susceptible to this aging, and unfortunately they feel it more, and that's why amyloid plaque buildup is more. That's why Alzheimer cases in ladies is twice as much as men. Okay, so a lot of people notice this. The people who come to my clinic, they say, "Oh, I started forgetting sentences, the words in the middle of the sentence." They say, they start forgetting. They are anxious, and what do we do? Many doctors, unfortunately, just give sleep medication, depression medication, something like that, and we just tell them and maybe take supplements. Okay. But, we can't just really dismiss this. Alzheimer is serious, right? When the estrogen declines, Alzheimer plaques, those amyloid plaques increases 20% more, like accelerate, okay? As you know, amyloid plaques are misfolded, junk, accumulated proteins, okay? So, it depends how much it is. Some people, even though they have a lot of amyloid plaques, they may not have clinical Alzheimer symptoms yet. So it depends on the person as well, and lifestyle is very important, as I said. So it's a risk factor. Having amyloid plaque in the brain is a risk factor, right? So, and also Alzheimer diagnosis is not made just with the imaging of the brain, seeing, presence of amyloid plaques, as I said, it's clinically. So, that's why we do this mini mental test in the clinic. That's how we decide. There are like 14 questions or something. So we just look at the answers, and then we calculate the score, and we make the diagnosis clinically with that test. Probably neurology has different tests. They may do further, but in the primary care, that's what we do, and then we refer to neurology. Okay, so as I said, Alzheimer is not elderly disease. Alzheimer is mid-age disease. Okay, so it starts in middle ages, especially in women. Now we've been talking, so 40s, 30s, even 30s, 40s. Okay, we have to take care of ourselves very well. Okay, especially menopause is like medical menopause. If they remove the uterus and ovaries, so those are even higher risk factor. Okay, so when a doctor if you have abnormal uterine bleeding, and then you were diagnosed with fibroids, and they want to remove the uterus right away, sometimes even ovaries. So please get a second opinion, try to get rid of these fibroids with the other means. Just don't settle down right away to get these your organs out. Okay, they are very critical. They are putting you, this medical menopause is putting you even at a higher risk. Okay, so just be mindful about that. That's very important. And in that situation, they start hormone treatments. So even then, that's still a risk. Okay, you're taking hormone from outside. So, and okay, so those ladies, they are, I think, guaranteed that they give hormones to those people who have early menopause, medical menopause like that. But we all can have hormonal treatments, okay? So that's why there's a big movement about this. A lot of women are becoming their own advocate. They don't want to suffer, okay? And there are big advancements about hormone therapy. I will talk about this next week and maybe the following week. So you can write your questions about that. So as I say, doctors usually dismissive. They don't want to start the hormone treatment. They just, whatever the symptom is, they just treating the symptoms like kind of, I'm not blaming anybody, myself even, we didn't get the training for this. I mean, it is in our scope of practice, but we don't really treat a postmenopausal woman. We just think, okay, it's a normal stage of life, just deal with it, you know, it's gonna be temporary. Here is your the antidepressant, here is your psychiatric referral, and here is your sleep medicine. That's what we do, unfortunately. Okay, so I'll talk about this another time, but right now, what we can do ourselves, okay? Let's see how we can prevent this deadly disease, Alzheimer, okay? As I said, hormone replacement is from this, so we're gonna educate ourselves and we're gonna go seek, okay? We're gonna go to our doctor. So don't get ashamed, don't get like a hesitant. You know how our thyroid hormone is missing, they just give thyroid hormone. You know, in diabetes, you know, they cannot control the sugar and then they give insulin. Think like that, okay? Especially now there is big advancements in hormone treatment. Okay, so what we can do? Diet. Okay, we've been talking about this diet a lot, like with everything, right? So diet, anti-inflammatory diet. Okay, that's what we need to do. Okay, that's why we're doing this program, alkali diet, this diet, that diet. Okay, so what's more important is a lot of fresh green fruits and vegetables raw. Okay, those are very important, like micronutrients. Omega-3, we've been talking about omega-3, right? Omega-3 is so important about reducing the inflammation. As I said before, there are two pathways in our body with these oils, essential oils, like the pathway, these important fats like omega-3 pathway and omega-6 pathway, right? We have to keep ourselves on that omega-3 pathway. We have to get rid of all these omega-6 oils, okay? So let's reduce the inflammation in our body with omega-3s. What are those omega-3s? Flaxseed, chia seeds, algae, you know, fish, okay, big fish, but if you can find clean fish. But as I said, what is fish eating? You know, where is this fish getting the omega-3 from, right? It's algae, okay? I get my omega-3s from algae and flaxseed, for example, okay? Do not eat processed food, okay? It really messes up your brain, okay? There are all these diet wars out there. The best one is proven, that's Mediterranean diet, okay? But Mediterranean diet can be interpreted differently in all the Mediterranean countries differently, okay? So what's main common best part of Mediterranean diet is fruits and vegetables, okay? Let's focus on that. Beans, lentils are important too, but mainly fruits and vegetables, that's the most common, you know, amongst all the other Mediterranean countries, okay? So and it's proven with depression, Alzheimer, everything, reducing the anxiety, reducing the heart disease, especially the DASH diet. You know, that Mediterranean diet, when you remove the salt, it becomes DASH diet, that's the hypertension diet, right? So to reduce the inflammation is very important. We're reducing cancer risk, hot flashes risk, and you know, all the inflammatory conditions we can reduce with Mediterranean diet, okay? It is proven. So the reason why this Mediterranean diet is good for postmenopausal stage is because of the phytoestrogens. There are phytoestrogens in the plants, okay, especially omega-3 ones, as I said, like is flaxseed, there is sesame, there is apricots, for example, all the fruits and vegetables, okay, there are phytoestrogens. For example, in Japanese woman, in Japan, there is not even a word for hot flashes. Why? Because their diet is so rich in phytoestrogens. First of all, soy and yam. Actually, that's how they make bioidentical hormones from soy and yam. So every day they are eating these ladies, every day they are eating this. That's why they don't have hot flashes. That's why probably, their brain stays sharp in those blue zones. As you know, this Okinawa is the first blue zone. They are in their hundreds and their brain is still sharp. Okay, so what are the supplements? Vitamin D is a must. You have to have vitamin D. Okay, so very important for your brain. There are vitamin D receptors in your brain, and vitamin D is a transmitter, it's a hormone as well, not only vitamin. Okay, so that's a must. And magnesium is important. Özellikle especially magnesium L-threonate is even more important. Okay, L-threonate I think is the one that can pass from blood-brain barrier. That's why L-threonate, it's they think that L-threonate magnesium is better than the other types, but any magnesium should work if you cannot find L-threonate. Exercise is so important. Okay, even walk. Okay, fast walk is very important. So if you can do brisk walk, it's better for your balance, better for your cardiovascular health, better for your muscle building and bone building, and calf size, for example. There is a big correlation between the gray matter in the brain and the calf size. The largest your leg muscles, largest your brain size. Okay, that's very important. Okay, especially weightlifting. If you're doing exercises for muscle building, you need to do more on the legs. Okay, upper body is important, back is important, but more legs. Okay, because of this reason, the study I'm telling you about. Okay, so what's the other thing? You have to use your brain. Okay, stimulate those brain cells. What do you want to do? Do you want to learn another language? Do you want to learn how to play a musical instrument? Just be curious. Start challenging your brain. Do something, help others. When we're helping others, we use our brain a lot. So yes, you have to challenge the brain. Okay, we cannot just expect everything from the diet, from the doctors. We have to use the brain. If you don't use it, you lose it. That's simple. Okay, so push that brain. Okay, what's the other one? Fasting, intermittent fasting. Remember, we've been talking about the 16-8, and we are doing our challenge as well. 16-8 is very critical, very important. It's like lifestyle. You have to do it almost every day. So eating early dinner is the best, okay, to reduce the inflammation. Inflammation one place, inflammation everywhere. So our goal is to reduce the inflammation. And remember, when you're fasting, when your body cannot find food, it eats the amyloid plaques in the brain that causes Alzheimer's, right? Our body is so smart. On the hours of fasting, what is it gonna eat? It's gonna go and eat those plaques. Okay, please think like that. So as I said, early dinner is better, but if you can do at least 3 hours before you go to bed, that's okay. But 16 to 8, that's the best. Okay, so you have to manage the stress. The other thing, if you're on chronic stress constantly, that is unfortunately very detrimental for our brain. Okay, when cortisol levels rise, estrogen goes down. When cortisol goes down, estrogen increases. Okay, it's just like we have a little bit estrogen left at that stage. You don't want cortisol to steal that estrogen. Okay, please, you have to find a solution for your stress. Okay, so you are the solution for that. Meditation, it is proven. You don't need to invent the wheel again. It is proven meditation increases the gray matter volume in the brain. Okay? Breathing exercises, massage. This is the time to invest in yourself. Okay? So far you just took care of other people. Now you are your baby. You're going to take care of yourself. Okay? You are the most important person in your life right now. Okay? So you need to be in a good weight. You should not be overweight. Okay? When you're overweight, there comes host of problems. Okay? You start having all that inflammatory cascade in your body. That's why in this program, in these challenges, we're trying to reduce the stress. And also inflammation, and also our weight. Okay? So if we're constantly bathing our brain with high sugar and then all this saturated fat, LDL, bad cholesterol, always having high blood pressure, it's very bad for our brain. Okay, we have to check and we have to keep on top of these numbers. Okay, keep the stress level, as I said, bad cholesterol, get those numbers at least every year and do something about it. Don't expect solutions from the medications. Cholesterol medication, a lot of people cannot use cholesterol medication because it causes forgetfulness. Okay, and they reduce it so much sometimes, and your brain cannot operate because there is not enough cholesterol in your brain. And blood pressure medications are the same thing too. They just don't let enough oxygen or blood supply to your brain, those blood pressure medications. Okay, we are not expecting everything from the medications. And get your genes checked. If you have people in your family, your elderlies, if they had dementia, Alzheimer, please get these apolipoprotein gene checked. APOE4. Okay, get this gene checked. Information is power. Learn. If you have this test positive, if it is positive, it means that you have to work even harder to prevent Alzheimer's. Okay, you don't want to wait until you have Alzheimer's symptoms, then that's too late. Okay, so do the best for yourself. Be advocate of yourself. Don't leave it to the doctors, don't leave it to other people. Okay, you are the one who is going to take care of yourself and prevent all these diseases. Okay, so I'm finishing off right now. Next week we're talking about again menopause, maybe hormone replacement treatment. The next 2 weeks we're talking about menopause again. Okay, write your questions. I can answer, and then I can even prepare my presentation with the questions you have. So, and also again in the program next week we're doing 1,300 calorie for ladies, 1,300 a day. We're tracking in our app, MyFitnessPal, for example, and for the gentleman 1,900 calories a day. Okay, Okay, I'm finishing off right now. I'll see you next week again, Thursday. Bye.